Hi, so in this introductory lecture, we will learn on the role of the pharmacist as part of PM1C module Introduction to Professionalism and Practice. This is Dr. Hisham Al-Abeidi. I'm the module convener from PM1C. And this is my email address, and this is my office if you'd like to have further help. Okay, so just to give you an outline of the aims and objectives, the aims of this session is to introduce the role of the pharmacist. And then we all know, you guys have seen the pharmacist, but I'm going to go sort of in depth and give you some general idea, the details of the profession, and what are the regulations with regard to the training of pharmacists. So the objectives are to discuss the role of a pharmacist and the requirements for registration. And then describe the different career paths available to pharmacists. And this is going to be quite important thing for you to learn when you progress throughout your MPharm degree. So what is a pharmacist? As a definition here is given a person who is professionally qualified to prepare and dispense medicinal drugs. So it is an offense for anyone, including a pharmacy student or a pre-registration trainee, to use the title pharmacist, unless they are registered with the GPSC, the General Pharmaceutical Council. So this is what we call a protected title. So being a pharmacist requires steps for registration, just so they can deserve this title. So either become a pharmacist, they're going to go through the training itself, the degree, and then pre-registration. And then a person commits an offense who uses the title pharmacist without being entered as a pharmacist in part 1 or 4 of the register. Okay, so here just to give you an idea further about the role of pharmacist. So it's appropriately qualified person being a pharmacist, and then that entails that they have done the degree, they passed the exam, of course, and they've done the pre-reg year, and they finished the course. So we're going to just go through some details here. Successful completion of a GPSC MPharm degree, and that's where you are at the moment because you are in your first year of the program. After the 4 years, so when you finish the pharmacy course, you're going to have 1 year pre-registration year, and that's within this year you're going to complete the training. You can have the choice community or hospital pharmacy. There are some cases as well. There is a sandwich programs which entail splitting the program between hospital and industry or community and industry. Trainee is required to build up a portfolio of evidence. So basically they need to show how they achieved the requirements of being pharmacists. So there are set of evidences they need to show they have fulfilled, and demonstrate their competence while being observed at work. After finishing the pre-registration year, they need to, the candidate will need to sit the GPSC exam. We commonly call it the pre-reg exam, and that is going to be, that will, assuming they're going to be successful, they complete the GPSC registration exam, and they're meeting the fitness to practice requirements, and by that point they will be qualified pharmacists. One sector which is pharmacists work in are the community pharmacists, and then those are this is the sector probably everyone familiar with, responsible for all aspects of medicine storage and supply. That's, as the name entails, That means maintaining or making sure the storage conditions are correct. Provide information on the sale of over-the-counter medicine and other general health care issues. So possibly cough medications, some painkillers, creams, vitamins, and etc. Carry out clinical scrutiny of prescriptions, and in that scenario, just to make sure the prescription is correct legally and clinically. So that just to ensure there are no drug interactions, there are no mistakes have been made in terms of the dosing, and then oversee safe dispensing process. So making sure is the right medication is being given, and of course the right dose. And then counsel the patient on correct medication use, especially if it's a new medication, just to make sure that the patient knows how to take the medication. Some recent opportunities now is the community pharmacists work in GP practices and advise on appropriate prescribing, and some of them progress in more advanced clinical roles. Provide clinical consultations to patients after further education and training. And these are the opportunities now that we start in pharmacies, such as prescribing and advanced pharmacist roles. The hospital pharmacists are similar to community pharmacists. They are professionally responsible for all aspects of medicine storage and supply. They work closely with medical and nursing staff to ensure that patients receive the most appropriate treatment. So there is a significant inter-professional working. So basically working within a set of team of different professions, making sure they can communicate and can they contribute to the health of the patient. Their clinical education and training, obtaining clinical diplomas, and specializing in the field of specific interests. So in terms of, such as in cancer, so patient pharmacists who oversee chemotherapy, they're called oncology pharmacists. Can also work in specialties such as medicine information and manufacturing. So this is more to do if in cases, for example, there is a medication which was given, where a patient was given the wrong dosing, or some more information about the medications, whether they've been given in the correct way. So that's also a significant role for pharmacists. And of course, manufacturing. The day-to-day running of dispensary is more often carried out by pharmacy technicians. And the reason for that, because pharmacists, they want to focus more on more challenging role, especially when you're talking about hospital, which is very busy environment. Industrial pharmacists, they contribute by doing vital research and development of new medicines. And we all know, seen the pandemic, and there are quite few pharmacists who are involved in the research and in the manufacturing of the vaccines and treatment for the virus in this case. Work within multidisciplinary project teams and with the help of other scientists. Their contribution, of course, is very significant here, because they have this sort of different focus, different vision to everyone else, so that will help develop new medications, ensure the safety and quality of medicines, and also involve the quality and the quality checking process as a qualified person. So in this case, the qualified person will oversee the process. They will need to make sure the standards of manufacturing, for example, were followed, and they were to a certain standard. And that qualified person will be responsible for the whole process. Pharmacists will be able to do this role as part of their career. Ensure leaflets and advertisements are produced in line with good practice. So that means just to ensure that they contain the right details, and that they will have the right message to the patients. And of course, to make sure they have the correct legal recommendations. I mentioned earlier on pharmacist prescribers, and these they've witnessed quite a few opportunities for pharmacists, because these started since 2006, and then that where the pharmacists were allowed to start to prescribe. So this is the pharmacist independent prescriber may prescribe for any condition within their clinical competence. So for example, a pharmacist who deals with diabetes, so they will be able to prescribe anything which is related to diabetes. And of course, that depends on their clinical competence and their training that they have done. And the Reading School of Pharmacy runs an accredited postgraduate independent prescribing program. That's just for pharmacists who have the experience and they are willing to go through this path to carry on with their clinical role. Other roles for pharmacists, like we said earlier on, GP surgeries, some pharmacists work in A&E, some of them they work in primary care, CCGs and prisons. Some pharmacists they work more towards in medical writing and research, and some they work into the law and the regulation part of the profession. Okay, so the main thing here is for raising concern for what is the role of pharmacist here, because every pharmacy professional has a duty to raise any concern, because they have this role or duty of care just to make sure if they have any concern about individual or any situation that could be unacceptable and that could result in risk to the patient and public safety. And as you can see here, this is part of the GPSC guidance on raising concerns. And then you can also look for the original document or the full documents on the blackboard. So the pharmacists have also a duty of care towards the patient, just to make sure everything is okay, no issues. But also, likewise, if you may have concerns over the pharmacists, pharmacy technicians, pharmacy owners, managers, and employers. And then that case, because this is a regulated profession, then that could include any of those. So it could be their behavior, maybe their competency, maybe there's a working environment, any action which could compromise patient safety. And that works both ways in this case, because you're concerned about the patient safety and the public. And then that also explain why pharmacy is pharmacist specifically is a protected title, because it's been regulated. Okay, so if there's how to raise concern, if you have any concern about your placement, then you should speak to the member of staff supervising, or if it is any other concern, then you need to speak to the personal tutor. So this is you'll have the placement week, enhancement week, and we'll have a placement in the hospital or the community, and then that's going to be your chance to raise any concern. Okay, so for further information, you can refer to the General Pharmaceutical Council website. You can refer to the Royal Pharmaceutical Society, NHS careers, just to give you an idea how what type of roles for pharmacists, and then that gives you the full details on the legislation for pharmacy. If you have any question, just feel free to email me. There will be a platform here just to post questions, but like as mentioned in previous video, it's always good to share questions so everyone can benefit. So just to say here, the pharmacy to be recognized as the clinical experts who help people make healthy living choices. So this is quite important aspect of pharmacist role. I hope that was useful. If you have any question, like I said, just email me or post your question. Thank you.